Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, are glaucoma a silent killer? My first question for you is, what are the early signs for glaucoma and how can it be detected before any significant damage occurs?
Glaucoma, earliest the diagnosis, better is the treatment. So you can prevent from becoming totally glaucomatous damage. So you can only prevent this disease. You can stop the progression of the disease. If you want to stop the progression of the disease, earliest the diagnosis is the only concept. So any patient who is above the age of 40, who is having the family tendency of glaucoma, the patient who is having high power of glasses, these 3-4 patients are prone for the glaucoma, and they should take all the investigations required for the glaucoma investigations. That is called as a glaucoma investigations. There are 3-4 investigations which you have to do, then only doctor can label you as you are a glaucomatous patient. Without that 3-4 tests, nobody can label you as you are having a glaucoma. By seeing only eye, nobody can detect that this is a glaucomatous patient. So you have to undergo some tests, then only we can diagnose that patient is having glaucoma.
What are the risk factors for glaucoma and can it be prevented or slowed down with the lifestyle changes or medication?
Because like previously I told you, glaucoma is a preventive disease. You can prevent it. You can stop the progression of the disease by putting some medicines, by changing your lifestyle. The compliance of the eye drops has to be there. Means if somebody is diagnosed with a glaucoma and we have recommended putting the drops for 2 times, like 9 a.m. and 9 p.m. They should meticulously follow the timings of the drops, because at that time the eye pressure gets shoot. That's why we used to tell at the timing. So specifically patient has to maintain the timing, and they should avoid tobacco, smoking, drinking. These are the other factors that we usually tell to the patient at the time of diagnosis of the glaucoma. So if lifestyle modification they have done, I don't feel that glaucoma also you can stop progression.
How often should I get my eyes checked for glaucoma, especially if I do have a family history of the conditions, doctor?
If you have a family history of glaucoma and if you are above the age of 40, you should first go and check with your eye pressures. And every year, the perimetry is the test where you can say it's a diagnostic test for a glaucoma, where in a glaucomatous patients, specifically peripheral vision loss is there. Means side vision loss first and then central vision loses second. So you have to see whether your peripheral vision is getting loose or not, or whether you are losing your peripheral vision or not. So every year you have to undergo that perimetry test and eye pressure test. So if a patient is having a strong family history of glaucoma and if the patient is above the age of 40, they should go yearly checkup for the perimetry and eye pressure.
So doctor, your expertise and insights on glaucoma, a silent killer, are invaluable to this initiative, and we believe your participation will greatly benefit the patients.